Hi, this is your brother Kenneth. I'm going to be doing something new. Just talk to you about a topic during my week. Uh, this is the middle of the week for me. It's been busy, but a lot of fun. I really enjoy what I do, seeing patients. Yesterday I saw 34 patients, and today it's middle of my day. It's sort of I'm on lunch right now, and the morning was very good. I want to be able to pick up something that I saw either yesterday or today uh, in the middle of the week and just talk to you about how I approach it with a patient to help you learn to be able to take care of yourself. I talk to my patients, and my philosophy is that you are the master of your own health. I am your servant. I am there to coach, help you to prescribe medications that you need, and to help open doors for you and facilitate your direction of your care. And I do that with you. I'm right there with you to help you make the decisions, and we make them together. So, in that with that approach, I basically provide information and guide, and so I wanted to be doing that weekly with you, as at least I'll do that as long as I can, and just pick a topic to talk about. So this week, let's see, I've seen a lot of things. I'd like to talk about hypertension or high blood pressure. Let's pick that. Okay. I think that's a good topic. I've seen so many people with it as today and yesterday. Let's pick somebody I saw. Okay, they came to the clinic and their blood pressure was checked. We put a curve right here and check that. The nurse does that before they come to me, and their blood pressure was 160 over 95. Okay, that's a number that you'd get. And when the nurse brings the paper to me that I need to go see the patient, I notice that the blood pressure was high. Now I go in to talk with the patient. I asked him if he has had high blood pressure before. He's never had it before, and we I get other information from him. Many times blood pressure runs in families. So I asked him if his parents have had it, if brothers and sisters have had it, and stuff like that. I check. I just sort of check other things that are associated with it. We look at their weight. Okay, people who are obese often have high blood pressure. Just on the surface, we sort of look at basic things like that, and I ordered some blood work to be able to check different things that also that can cause hypertension, and also I check for other things that could be comorbidities with hypertension that could cause cardiovascular problems. So, the patient asked me what blood pressure is, and I explained it to him. Essentially, um, that it's a very simple thing. For your heart to keep pumping blood to go around your body and go from your heart to your brain and throughout your body, it maintains a certain pressure inside the arteries and veins to be able to keep things going. And your heart is a very important part of that. And so when your blood pressure is too high, you are at risk of many complications. Some of the complications, one, starting with the heart. Okay, just imagine your heart is a pump. It's like a pump that is pumping blood or water, and that it has to pump the water and supply the whole city or supply the whole body. Now, if the pressure that it has to pump against is high, then what happens is that the heart overworks, and when the heart overworks, the muscles can become thick, or your heart can eventually fail. You have heart failure, or when your heart becomes thick, we say you have heart hypertrophy. Okay, so and all of that is a problem. Okay, so when you have high blood pressure, it could also destroy or cause damage to your kidneys. It could cause damage to your eyes. We often would have to look at vessels in the patient's eyes to see. It could cause strokes. High blood pressure is something we have to take very seriously because of the damage it can have, again, on the kidneys, the heart, the eyes, and causing strokes and things like that. So I discuss complications like that. Again, diagnosis, we know because we check. We measure blood pressure at every visit that a patient comes in. And then in terms of helping the patient understand now what we need to be able to do, one, to approach it. I usually would get them a blood pressure cuff, because research has shown that when patients actually measure their blood pressure at home on a regular basis, daily if possible, that it actually helps them control their blood pressure. So getting them a cuff is something that I do, and they take their blood pressure at home. That actually, home blood pressure is something that I actually need to be able to fully confirm that the patient has blood pressure hypertension, because there's something they call white coat syndrome, white coat hypertension, where some patients have their blood pressure high every time they come to the office. I often joke with them and say it's high in the office because they're too excited to see me and the staff, and we'll get a laugh out of that. But it's a real phenomenon, and we check that by using blood pressure that the patient has gotten out of the clinic. And so I get them a blood pressure cuff. We talk about diet, and I coach them to eat the healthy diet, Mediterranean diet, and low carb, high fat diet to be able to lose weight and control their blood pressure that way. In fact, I see this over all the time. When a patient who was 50 pounds overweight, when I help them coach them to lose weight and they lose that weight, often I have to stop medications because they no longer have hypertension, because the heavier you weigh, the higher your blood pressure goes up. So we look at, I get them a cuff. Again, we look at their diet and coach them and help them to be able to lose weight. And then obviously we have medications that I prescribe to patients, and I'm not going to go into that because when your blood pressure is high, you're going to go see your primary care doctor, and they'll prescribe medications for you and talk to you about side effects and things like that. So that's in a nutshell. There's other things you need to know about blood pressure. Again, like when I order labs, I am wanting to look for what we call secondary hypertension. That's hypertension that is caused because of something. For example, there's something we call renovascular hypertension, where the veins in your kidneys small or clogged, and then that would cause hypertension. We look at different things that would cause a patient's blood pressure to be high and eliminate that. When we eliminate all of that, we often would something that is very common is obstructive sleep apnea, and I'll talk to you about that in a different video, since I see that quite often. Just to educate you on that, we look at all these different things. Look at the thyroid can be involved in causing hypertension, and we get all of that and look at their lab work and then narrow down that, okay, there's nothing that is causing it. This is simply because of they just have the hypertension because of weight and other things, the diet. I hope not to forget, an important part of dietary control is reducing salt intake and exercising and stuff like that. So we talk about that with our patients. If you have hypertension, talk to your doctor. They're going to help you be able to reduce your salt intake, which is very important in controlling your hypertension. So we look at all the things that cause secondary hypertension, and then we remove those. And then if none of that is involved, then the patient has essential hypertension, and we focus on treating that with medication and lifestyle changes. And I have patients often follow up. If I start a medication and then I'll want to see them in 6 weeks to 3 months to see how the medication is working, and they'll bring their home blood pressures that I've measured and bring them to me so I can check, and we go from there. The goal is to get their blood pressure to be not in the normal range, and again, the normal range is about 120/80. And if you're older, that range sort of we give more leeway. Like people who are older, I want their blood pressure, who are over 60 years of age, I want their blood pressure to be like 150 or over 90 or down. So that's uh, something that I want you to think about to educate yourself about hypertension. You can always talk to your primary care doctor, and if you have a question, leave a comment below. I want to use my skills and what I do with my patients every day and help you be able to be a master of your own health. Know that your health is a gift that God has given you. You're not God. You still rely on God, and you rely on providers like us to be able to help you, but you are in charge. You are the one who's going to lead it, and we are going to help. God has trusted that health to you, and I'm here to help you. And to leave you today, I just want you to remember that life is good, and I'm here to help. Leave your comment below, and if you haven't liked and subscribed this video, please like it. It helps us be able to get into many hands. And if you're not subscribed to the channel, subscribe. I'll be covering many different health topics, and also, as you know, I cover things that have to do with biblical lifestyle and relationships, love, dating, and marriage, also on this channel. That's it from me today. I'll see you in the next video.